Hi, I'm Josh Johnson. I am a physical therapist and researcher at the Cleveland Clinic and was fortunate to be awarded a pilot grant from CoHSTAR in 2019. CoHSTAR has, for the entirety of my young research career, been a guidepost. I remember as a physical therapy student at Arcadia University completing mentored research with Dr. Carol Otis. Dr. Otis was interested in understanding the outcomes for patients following total knee arthroplasty. And as part of that work, myself and two colleagues were able to do manual chart reviews from paper of about 180 records for patients who had undergone a total joint replacement and then were being treated in either home care or outpatient physical therapy. And we meticulously documented each intervention that those patients received in an attempt to categorize them and understand, with the help of a statistician, the relationship between the interventions that we categorized and the patient's outcomes. And this was my first foray into what I learned was health services research. And having learned that name, I started to explore resources that would enable me to continue to do more of it. And at the time, I remember hearing interviews from Dr. Bill Boisenalt, who was the Foundation for Physical Therapy Research president, that he gave at CSM and also via a PTJ podcast. And he talked about needing a cadre of health services researchers in physical therapy, and they were seeking to fund a center of excellence. And so I remember following closely the progress of those efforts until all of a sudden CoHSTAR was born as this collaborative institution from Boston University and Brown University and the University of Pittsburgh. And suddenly I had a whole set of resources available to me for health services research. After practicing full-time as a physical therapist for a year, I was fortunate to be able to become a PhD student and trainee at the University of Utah. And while there, I was mentored by Dr. Roger Marcus and Dr. Julie Fritz primarily, and was introduced to big data research in a new way. I was integrated into the clinical business intelligence units and was given access to the electronic data vault, and so was able to access clinical data from that research data bank that was pertinent to physical therapy practice, particularly in the acute care hospital where my research ended up focusing. And I came to learn that what we were doing was a learning health system. And that was a term that I now use often as I am striving to become a learning health systems researcher in rehabilitation. And what that means is essentially we were using data from everyday practice as recorded in the electronic health record to improve practice by learning from it and by partnering with our health system leaders and bedside clinicians to understand what it was that were the highest priorities for them in their questions. And while there, my dissertation focused on the role of acute care physical therapists, and particularly the way that they measured physical function and how that measure, which happened to be the AMPAC 6 clicks at that institution, could help us dictate or understand what the right setting might be for a patient's post-acute care. As a PhD trainee, I was consistent in attending CoHSTAR's annual institutes and being mindful of research from their postdoctoral and faculty fellows, and tried to collaborate with them and learn from them as much as I could. Now that I'm at Cleveland Clinic, I've tried to continue learning health system research as an embedded researcher, being embedded directly in the healthcare system now in which I have the opportunity to work. And my research continues to highlight what I've learned to be two primary roles of acute care physical therapists. It's first, being able to facilitate appropriate transition from hospital to post-acute care for ongoing rehabilitation. The second, and related, is to provide treatment for patients who need skilled rehab while they're hospitalized. And relative to those roles, my research now focuses primarily on helping patients to get home. And what does it take from physical therapists to facilitate that outcome for patients? So my CoHSTAR pilot funding is along those lines. We've developed here at Cleveland Clinic a program that we have called high-intensity home-based rehabilitation, which is a potential substitute for traditional facility-based rehabilitation. And so CoHSTAR has funded our effort to investigate our ability to intervene with patients after total joint replacement who may in the past have needed a skilled nursing facility for their rehabilitation, but instead helping them to get home and participate in appropriate rehabilitation at home. And it's been remarkable to continue to partner with CoHSTAR and have mentorship from CoHSTAR faculty, and now collaborate in a more ready fashion with those fellows who have gone through CoHSTAR's training programs. It truly is a remarkable resource for health services research and rehabilitation, and I'm grateful for their role in advancing my career.